I'm Dr. Roger Blumenthal, Professor of Medicine at Johns Hopkins and Director of the Johns Hopkins Chickaroni Preventive Cardiology Center.
And I'm Dr. JoAnne Foody. I'm an Associate Professor at Harvard Medical School where I direct the Cardiovascular Wellness Program at Brigham and Women's Hospital.
And I'm Dr. Nathan Wong, Professor and Director of the Heart Disease Prevention Program at the University of California, Irvine, and also the current President of the American Society for Preventive Cardiology.
This book is very user-friendly, and I think it's probably relevant to just about anyone that practices medicine and overlaps with so many of the patients that have risk factors for cardiovascular disease. I think that all too often we pigeonhole this kind of information to cardiologists, but really we need to get this information out to primary care providers, internists, even OBGYNs, in fact, who provide the bulk of primary care for women, given that cardiovascular disease risks start so early. And I think that's really our message. Our message is really trying to get the best information out to those individuals that take care of people at risk for heart disease. So again, I think it's really relevant to just about anyone in the practice of healthcare.
Yeah, I couldn't agree more. The vast majority of prevention is done at the primary care level. So it's extremely important that we communicate our messages in prevention as well as the key guidelines to the larger primary care audience. And this actually textbook has, a number of extremely valuable figures as well as tables and very, very nice summaries of key statements as far as recommendations regarding clinical management for the various risk factors, which we feel will appeal very well to both the actually primary care audience as well as the specialists, including cardiologists, as well as endocrinologists and others that are involved very much in preventive cardiology work.
And in the greater Boston area, the only two people more prominent than Eugene Brunwald and Peter Libby are Bill Belichick and Tom Brady. So clearly it was an honor and pleasure to work with Dr. Brunwald and Dr. Libby.
And from my perspective, having trained under both Dr. Brunwald and Dr. Libby, it really, who both encouraged me to pursue a career in preventive cardiology. This has really been a pleasure and really, from a career perspective, wonderful to work with both Nathan and Roger to really bring this project to fruition. I think it's probably the most comprehensive preventive cardiology text that exists, and hopefully will really set the standard for preventive cardiology going forward.
Yeah, and likewise, it's been a real honor to work with Roger and JoAnne on this important effort, and we hope there will be future opportunities to work together in actually continuing to promote preventive cardiology educational products.
Just got a text page from Dr. Libby. He said he actually is more prominent than Tom Brady and Bill Belichick. So, but of course, I'm not actually sure he knows who Tom Brady is. So it's hard to know that for sure.